I think the SPS program was an initiative within CUNY to address the growing need and the growing demand in both New York City area as well as across the country for nurses to go back and get their bachelor's degree. Based on a landmark study and report that came out in 2011 by the Institute of Medicine referring to the future of nursing. They looked at healthcare delivery in this country and they saw that the key player in healthcare delivery was the nurse. And so in looking at how healthcare was changing, the influence of the Affordable Care Act, the influence of organizations and practices such as magnet status, institutions were beginning to demand that nurses have a bachelor's degree to be able to work interprofessionally, to be able to work collaboratively, and to be able to move into the new realm of healthcare delivery, which is not going to be about episodic acute care, but is really going to be about caring for people across their lifespan, across the healthcare continuum from being in the hospital to transitioning to home care to transitioning to the community, and how are we going to follow these people? Chronic illness is what is really driving healthcare today. There are more people that die from chronic ailments than 50 years ago when infection was the most common cause of death. Now we see people living long lives with heart disease, with cancer, with diabetes, with HIV. Their illness and their health care doesn't go away when they go home from the hospital. They're in the community living with this, and nurses are a big part of helping to manage that care. So SPS is helping to provide nurses with the tools and the skills and the leadership and the management that they need in order to be able to work interprofessionally and to be able to manage care for these many kinds of clients who will often have more than one kind of disease entity as opposed to just a single thing.